Okay, good morning, everyone. Welcome to our first CNIC webinar since our prestigious Leader Summit that we held back in June. I know many of you who are probably on this meeting today or joining us as part of this event participated in that, which is very exciting. I'm happy to announce that we will be bringing it back in 2025. So please keep your eyes and ears tuned for more details and a save the date, hopefully coming in the next couple of weeks, because I know the fall and spring fill up pretty quickly. So we want to make sure that we're far ahead of that for you guys. But really pleased to host this event today, primarily because as many of you know, there's been a tremendous amount of growth in the isotope sector across Canada, and growing in tune with that has been the CNIC. And we always want to make sure that people are aware, both the public and public servants and officials are aware of the excellent work that these organizations are doing, as well as our own members, to understand business opportunities to work together and collaborate, and ultimately continue to push forward nuclear medicine, research, and ultimately economic development for Canada from coast to coast. So we thought we'd kick off the back to school week with a little bit of a kind of a who's who of who's been joining and becoming a part of the CNIC in the past couple of months. And again, give you that broad flavor of the various activities that some of our members are engaged in, again, to really understand that the CNIC is an organization that encapsulates all aspects of the medical isotope and non-medical isotope supply chain, as you'll see today, some of the various applications. So with that, I'm going to hand it off to our first speaker. There is an opportunity, hopefully at the end, for some questions. So if you have any, put them in the chat. We will try to get to them. But I really want to ultimately showcase Canadian isotope excellence, as the title suggests. So with that, I am going to hand it over to Mohammed Hamid of Radiotome Technologies. Mohammed is the co-founder of Radiotome Technologies, bringing over 18 years of experience in the radiopharma and molecular imaging sectors. He leads a team of dedicated individuals delivering radiopharma technologies, radiation shielding solutions, and engineering. And that's all I'm going to say, because he'll tell you more about it. So over to you.
Thank you, Alex. So Radiotome is just a little introduction. Was born out of a lot of experience into the field of radiopharma and molecular imaging. Been involved in it for 18 years, over 18 years now, and we kind of spun off from different companies. Our focus is primarily on the engineering solutions, the engineering services, providing that know-how that we've developed in Canada and exporting it to the rest of the world. So basically what our mission is to leverage Canada's strong engineering capabilities, the regulatory expertise, the radiochemistry innovation that's in this country, and allowing others around the world to benefit from what we know. We are always looking to collaborate with the ecosystem to deliver. We notice that in Canada we have well-known institutions such as Triumph and cyclotron manufacturers like ACSI and BEST, and even some technologies like the reactor technologies, CANDU reactors. This well positions us in the market to be the leaders in engineering facilities around the world. The key players contribute to Canada's position as at the forefront of nuclear R&D and radiopharma innovation. And we leverage the strength of the Canadian ecosystem and utilize the wealth of the expertise that we have in this country to benefit patients around the world. So Canada has a unique position, taking a leadership position in developing isotopes. We have a very strong engineering core that developed some of the best isotopes and some of the most important isotopes that are distributed around the world. In fact, Canada was leading even in the moly production for some time, and now with the emergence of theranostics, there's a lot of organizations that are involved in that. And what we're doing is we're exporting that strength, the strength not just from the engineering side, but the know-how of the regulatory expertise, the know-how of the radiochemistry. There are some strong radiochemistry programs in Canada, and I would mention that we've worked with people who came out of McMaster University for so long, past 18 years. In fact, some of the facilities that we've worked with are people that were leaders that came out of the strong radiochemistry program. In fact, some of the companies that spun off around the world and got acquired were led by people that came out of McMaster, and we're proud of that. And so we find a lot of opportunities to expand that knowledge and know-how into Europe, Middle East, Africa, and Asia. There's a growing demand for high-quality radiopharmaceuticals, and especially in Asia and in the MENA region. And we get a lot of requests for the know-how from those regions. In fact, we obviously put together and integrate technologies, but the core about this is how to put everything together, like all the pieces of the puzzle together. So while we have a lot of strengths in Canada, we have a lot of improvement to make, and especially in terms of challenges that we as businesses or startup face. And primarily what we found is we find a lot of the challenges are practically around the processes, the certifications, the attestations, the regulatory, that in fact have caused difficulties to raise investment recently because of some of the hurdles or the barriers that we've been facing as well. Let alone, obviously every country has taxation hurdles, but I think that the processes is the most important hurdles to overcome. So we need to work very well with the government to streamline administrative processes, reduce red tapes for certifications and approvals. As important of things as small as attesting documents from foreign affairs, for example, where we found some of the opportunities where we would nearly miss in this time-critical industry just because we couldn't attest documents in time. And so, and it's more so strangely nowadays versus in the past. I've been involved in startups for quite some time. It was surprisingly easier to do it back in the early 2003, 2004 than it is today. There are added steps that perhaps we should look into. And to encourage investment into innovation, we would like to see, recommendations into, offering grants or tax breaks or funding programs for newly popping up engineering manufacturing companies that can provide innovation or bring innovation to Canada. So Canada has very stringent regulatory, you know, organizations and compliance. And so for us, we would like to see regulatory compliance hurdles that are lifted, and particularly in the development of the isotopes and GMP facilities, or and not necessarily lifted, obviously, because we need those regulatory, but more streamlined, streamlining the processes, and to utilize Canada's deep regulatory expertise to navigate. You know, we try to utilize the deep regulatory expertise to navigate these complexities and ensure that our products meet the highest safety and efficacy and the standards. So we advocate for closer industry-government collaboration to create more supportive regulatory environment and foster innovation and growth. So Canada has, and as I said, has a very unique position. We notice that. We see, you know, projects like actinium being worked at in Triumph, or, you know, the CANDU reactor, which is important in many aspects, and especially in some countries that can't, for many other reasons, that can't make larger reactor programs. CANDU reactors are great technology to propose to the world or to promote to the world. You know, promoting the cyclotron manufacturers within the services of the engineering. So we have these assets. We have the assets of the know-how of making the isotopes, and we as Rayatum work effortlessly to promote the know-how, really putting in the pieces together to the rest of the world. So that's really a recap of what we are doing in Rayatum, and what we would like to do as part of the Canadian ecosystem is to collaborate together, work with all the industry elements, work with the leaders of the industry, try to see how we can overcome the barriers, the regulatory, and provide the regulatory expertise, and enhance and boost Canadian innovation to the rest of the world, and promote it. Really, I think people need to know what Canada is in terms of the isotope production, and what we can do, and how we can help you know, alleviate the healthcare systems all across the world. Supply chain challenges is something that you know, we as in Canada can work to help, and practically you can do that through licensing. A lot of you know, a lot of the Canadian institutions that can develop programs in Canada, there are some institutions around the world that perhaps have the capability to, or have the funds to, but don't have the know-how to do it. And so licensing is a great thing to look into. And this is something that we can collaborate with the industry across the Canadians, you know, the entire spectrum, and see how we can promote Canadian innovation to the rest of the world. And we need to continue to invest into companies that are innovating in this field, call into action, and work with government to try to alleviate all the barriers that companies go through, so that we can become competitive in this domain, and especially that we have such a strong and robust isotope production capabilities. That's it from our side. I hope I met your time.
Awesome. Thanks so much, Mohammed. And a couple of takeaways, I think, for everyone, and myself included. I need to capitalize the A on Atom, so I know it's Rayatum Technologies as opposed to Rayatom. My apologies. That's I think this might be the first time we've actually seen each other in person, or I guess virtually in this regard, since you guys joined late in May and you're up in Canada. But again, that just speaks to kind of the diversity of the CNIC. And I think my other takeaway from that is, especially on the last couple of slides there, is the policy landscape to all of this. And it'll please CNIC members to know that we are actually undertaking a whole revamp of our policy and thought leadership program. We've had some very successful advocacy days and Hill days in the past, but we want to make sure that we're catering to the exact needs of our members to address the specific challenges. So over the next couple of months, our policy lead, Amanda Tieber, will be reaching out. So keep those thoughts in mind, definitely, when you speak to her, because without the right type of policy, we're not going to get the change that we need. So if you don't mind unsharing your screen, Mohammed, I'm going to introduce our next speaker, who is Steve Metler, is the acting president of nuclear medicine at Mirion. Mirion is a global leader in nuclear instrumentation and radiation detection, monitoring, and safety, and partners with customers to build solutions that fundamentally change what's possible in science, industry, and medicine. Steve applies over 30 years of experience to his technical and managerial roles. And I was pleased to meet Steve at our Leader Summit, again, back in June, and look forward to your presentation. Over to you, Steve.
Great. Thanks, Andrew. Thanks, Melody. And thank you all for spending some time with us today. I'm going to briefly go through an overview of Mirion Technologies and talk about some of our activities in Canada. And hopefully we'll have time at the end for questions and answers. Mirion's mission is to harness our unrivaled knowledge of ionizing radiation for the benefit of humanity. I think this is germane to the emerging theranostics that are coming out, and it's really core to our diverse operating divisions. It's one of the things that brings us together as a group. Core to these values is improving safety. So safety, I guess, is best embodied by providing radiation protection equipment to various nuclear facilities. It really enables, I think, the future generation of safe, clean nuclear energy, as well as providing quality control and efficacy of beam therapy today and in the future. I think some of the theranostics that comes out. We were founded in 2005, although some of our legacy divisions started much earlier than that. And I am going to talk about some of the Canadian facilities at the end. We have over 130 patents, 700 unique products. We're the leading product category manufacturer in 16 of 19 product categories. We have over 2,700 employees and operating in 12 different countries. I think we have over 20 industrial facilities, including 2 in Canada that I'll talk about later. We have 2 operating groups. So the medical group, which I'm part of, so nuclear medicine is part of our medical group, and our theme is better solutions, better outcomes. We also operate a division that is the world leader in radiation therapy QA or beam therapy QA systems, phantoms and alignment division, and also dosimetry is in the medical group. In the technologies group, which is larger than our medical group, we probably have more diverse offerings, but it's really about radiation safety. So radiation protection, high purity germanium gamma spec systems, contamination clearance monitors, really a broad array of products that is provided to global nuclear facilities around the world, including in Canada. If we take a snapshot of really the supply chain of radioisotopes, a lot of Canadian activities are very significant in the isotope production currently. So that's accelerator-based or nuclear reactor-based isotope production. And then that would go to a compounding radiopharmacy, a nuclear medicine department, and an administration in a hospital. Mirion has leading products and services in all of these segments. To touch on a few, in Canada, for example, we're providing stack monitoring equipment to Bruce Power, which is producing lutetium-177. We're working with BWXT Canada and some of the air monitoring for the safe handling of radium-226, and a variety of other activities in Canada that we're happy to be a part of. In terms of our operations in Canada, we have two of our perhaps 20 global production facilities are in Canada. The first is in Concord, which is a world leader in health physics instrumentation, specifically contamination and clearance monitors. and that's in Concord, Ontario. And then in Cambridge, Ontario, it's our sensing division. So we're the world leader in self-powered neutron detectors. These are used in core to monitor reactor performance during operation and as it's ramped up and shut down. And shout out really to Angie D'Agostino, who's our GM of our Concord facility, and Ian Wilson, who's up in Cambridge, Ontario. And we're selling and servicing our broad product portfolio primarily out of the Concord, Ontario facility. That's what I had for today, Andrew.
Awesome. Thank you very much, Steve. And again, I love this graphic. And again, it just speaks to the kind of diversity of activities and also the spectrum of places of which we all are doing this work. I think maybe, I don't know, we have 150 people right now, maybe someone from Concord or Cambridge who didn't know you were right in their backyard. And I always find that incredible, whether it's the nuclear supply chain with, you know, some of these equipment manufacturers right in little communities tucked in like Burlington, providing hundreds of jobs for Ontarians and Canadians more broadly. And it's really fantastic to see. And I think, again, the CNIC really wants to pull attention to the work that's happening in these communities. These jobs are right in your backyard and are obviously a huge economic development tool for our country. So thank you very much, Steve. Really appreciate it. And again, thank you for joining the CNIC. We look forward to working with you over the next year. I'm going to move on to our next speaker, who is Sean Ramdhani from NUCM Radiopharmaceuticals. Because I don't want to pronounce anything wrong, I'm not going to call it Nucum. I'll let him do that first, if that's what he wants to do. Sean is a nuclear pharmacist with over 25 years of experience in hospital, academic, and centralized radiopharmacy environments. Sean's expertise includes nuclear pharmacy sciences, radiation safety, aseptic compounding, and controlled drug substance quality and reg affairs. Currently, Sean is the Chief Scientific Officer and Board Director for Nucum, a Health Canada licensed radiopharmaceutical manufacturing facility in Oakville. So we're going to another place here in Ontario. So over to you, Sean, and thanks for joining us.
Hey, thanks, Andrew. Can everybody hear me? Just checking my sound, and I think we're good to go. Just waiting for my slide deck to come up. So while we're waiting for the slide to reflect, it's indeed a pleasure to be invited to present at this informative CNIC event. Thank you to Andrew, Melody, and the team for this opportunity, and we look forward to future webinars. So I represent Nucum, a Health Canada and CNSC licensed radiopharmacy. Just waiting for my slides to come up.
They're up, Sean, so maybe you just can't see them, but we'll flip through them whenever you're ready.
Wonderful. Okay, thank you so much. So first slide is essentially a description of today's agenda. So we're going to be focusing on a few things, on the Nucum executive team, a chronology of nuclear medicine and radiopharmacy applications, the vital role of radiopharmacies in that final critical last mile of radiopharmaceutical deliveries. And the most important thing that we want to focus on are the indications and applications for radiopharmaceuticals and nuclear medicine, and the burgeoning applications that we are noticing for these procedures. Next slide, please. In terms of the executive team, just confirming everyone can see the slide decks, right? Okay, yep, perfect. So Nucum is led by Nina Kanwar, for lack of a better term. Nina is a legend in the field of nuclear medicine. Nina is a nuclear medicine technologist by training and previous founder of KMH Cardiology Network Centers, one of the largest privately owned nuclear cardiology franchises in North America. And in 2020, Nina founded Nucum to address the diminishing supply of radiopharmaceuticals and options for radiopharmaceuticals. So Nina is president and CEO of the company. I am a CSO and radiopharmacist. I have over 25 years experience in the field of nuclear medicine and radiopharmacy. Board certified in 2008, and I've held multiple leadership roles in hospital, academic, and commercial radiopharmacy sectors, as well as contributing to the College of Physicians and Surgeons of Ontario to define practice guidelines for the compounding, preparation, manipulation of radiopharmaceuticals. The quality and regulatory aspects of radiopharmaceuticals are crucially important for the development of the field. Next slide, please. This is just a brief history of nuclear medicine and the developments in this field, starting from the late 1800s with Henry Becquerel developing or finding the first effects of X-rays, then the Curie family developing finding effects of different radioisotopes, example radium, and then just down the road in Brantford, Alexander Graham Bell doing some amazing work with radium isotopes. And then in 1960s is where the real development of nuclear medicine happened in the SPECT realm, and we'll focus on those acronyms in a little while. The first rectilinear scanner, and then the development of ligands for SPECT nuclear medicine really started to come to fore in the late 1970s with products like MAA, macroaggregated albumin for lung perfusion, and myocardial perfusion imaging drugs, which really put SPECT nuclear medicine on the map. In the late 1990s, early 2000s, that's where the real focus on precision medicine started with the development and innovation of cyclotrons, which are essentially particle accelerators producing PET isotopes. And that led to fusion technology of hybridized imaging with PET-CT, SPECT-CT, PET-MRI being the forebearers to theranostics, which there's a lot of buzz around right now. Next slide, please. So we're focusing on radiopharmacy, nuclear medicine, but how does this modality in particular compare with the other medical imaging modalities like X-ray, ultrasound, MRI? So with those modalities, you're looking specifically for anatomy, so localization of a pathology. It doesn't really give you too much about physiology of the effect. So that's where nuclear medicine comes in. So on the bottom left side, you'll see a graphic showing the sensitivity and specificity increasing with nuclear medicine applications down to a molecular basis. And this is where sensitivity, specificity, and precision comes to the fore. So the main difference with nuclear medicine and X-ray and CTs is with X-ray CT, you're passing a beam of radiation through the patient. In nuclear medicine, you're injecting the patient becomes radioactive, and this is how we see images of pathology. As an example, the areas lit up are suspect pathology areas. Now, this can only be possible if we are developing and producing these radiopharmaceuticals in a safe, effective manner, and this is where the radiopharmacies come in. The top right-hand corner depicts what is called a generator, in this case, a molybdenum technetium generator that we elute at a radiopharmacy to produce our radiopharmaceuticals. So in essence, a radiopharmacy is brilliant in its simplicity of eluting a generator to form your isotope, adding your isotope to a cold kit ligand, forming your radiopharmaceutical to then inject into your patient and image the patient. So in essence, this kind of encapsulates the weird and wonderful world of radiopharmaceuticals. Next slide, please. So slide 5 speaks about the vital role of nuclear medicine applications for different indications. And the 3 broad buckets that we'll speak about today, 3 categories are SPECT nuclear medicine using single photon emission computed tomography, PET, positron emission tomography, and the therapeutic aspects. The left-hand image depicts applications in the European context, And the right-hand table shows utilization across the provinces of PET, SPECT, MRI, and PET-CT in Ontario, and the rest of Canada. You can tell from our utilization, especially of PET-CT, that we have a long way to go to meet the demands by our fellow healthcare professionals in cancer staging, neuroscience applications, etc. Next slide, please. So this is courtesy of CNIC. These graphics on the CNIC website are really informative for the public consumption to give the public an idea of the wide array of nuclear medicine applications. 1.4 million diagnostic imaging procedures in Canada per year, where technetium-99m is seen as the workhorse isotope for these procedures. There's a lot of buzz, rightfully so, about new therapeutic isotopes, etc. But we cannot ignore this vital isotope used for diagnostic SPECT imaging. More than 60% or 80% of the global nuclear medicine applications utilize this vital technetium-99 isotope. Next slide, please. So the radiopharmacy's role is vital in the provision of this sensitive, time-critical drug to the end user. And it's even more critical based on the burgeoning new applications of radiopharmaceuticals, whether it's new application in SPECT, PET, or therapeutics. Regulatory and logistics. The process of delivery of a radiopharmaceutical to the end user within a short time frame due to short half-lives takes almost military precision. And radiopharmacies are perfectly situated in that regard to effectively deliver that right dose to the right hospital at the right time. Drug developers are investing billions of dollars in radioligand development. We've all seen press releases of companies investing in this new and burgeoning field of radiopharmaceuticals, but we need the radiopharmacies for that final mile of dose provision to ensure time criticality, quality and regulatory issues are addressed, and the dose is administered to the patient in a safe and efficacious manner. And this is why collaboration and synergies has to exist between drug developers, regulators, radiopharmacies, and nuclear medicine departments. Next slide, please. The slide is a little busy, but it gives everyone an appreciation of the work that's done every day at a radiopharmacy to ensure doses arrive at the end user site in a safe and effective manner. The slide, the picture to the top left-hand side shows the supply chain for one critical isotope, technetium-99m. This is sourced from a generator, which is a molybdenum-99m technetium generator. And the molybdenum parent isotope is sourced from a nuclear reactor, uranium-235 fission, causing byproducts, and molybdenum is a key byproduct of that reaction. That molybdenum is then sent to processing sites, generator production sites, and finally to the radiopharmacies for elution and incorporation into the radiopharmaceutical. From the process, from the time of bombardment of that uranium to the time of delivery to the radiopharmacy, we're looking at 72 to 96 hours. So this is where I say the military style precision that's required for the delivery of this sensitive, radioactive, short half-life dose to the patient is critical. The slide to the bottom left shows the limited number of nuclear reactors around the world capable of producing this key molybdenum-99. Sorry if the graphic is a little small, but feel free to contact me and I'll provide you this information. We find that there's only a certain number of reactors capable of producing this isotope. Example, the NTP South African reactor. There's reactors in Belgium, Europe, Australia. Canada was a major source of molybdenum-99 at the Chalk River reactor. Unfortunately, after the closure of that reactor, there was a severe void in the market, but we're looking at Canadian technology to bridge that gap. And this is where the sensitivity of getting a generator through the supply chain to the end user is so critical. Next slide, please. Just a general overview of the difference between SPECT and PET scans. SPECT is an acronym, as I mentioned, for single photon computed tomography. The source of the isotopes are primarily reactor-based, like technetium-99m, that's sourced from a generator. And SPECT radiopharmaceuticals are indicated for cardiac myocardial perfusion imaging, lung imaging, skeletal imaging. Those are the ubiquitous indications. The image shows the cardiac imaging modalities. That's so important in SPECT nuclear medicine. And it's easy to see area of defect. The light yellow is an area of ischemia in the heart. So that's how a nuclear medicine physician will target the pathology in a particular region of interest. PET, on the other hand, is sourced from primarily a cyclotron, which is a particle accelerator. PET is an acronym for positron emission tomography. And the sensitivity and specificity of PET is a lot superior. And this is why it's used now for cancer staging and an integral component for diagnostics. Cancer is not the only indication for PET. The neurological applications are increasing. Image shows a normal and suspected Alzheimer's patient with cerebral PET scans. Next slide, please. This slide focuses on the buzz term right now in nuclear medicine, which is theranostics, which is the amalgamation of diagnostics and therapeutics. So the image reflected on the left is the Society of Nuclear Medicine image of the year. I believe it was 2018 or 2019. And it shows 8 patient subsets for prostate cancer. And I'm sure the Novartis folks who are on the call today would enjoy seeing this image, because it's a drug that's having immense impacts on treating prostate cancer. The red dots are prostate tumor metastases, and for each patient subset, you're seeing almost complete resolution of the tumors based on this theranostic treatment. And theranostics is, once again, brilliant in its simplicity by targeting cancer cells based on the antibody. You localize a theranostic agent as close to the nucleus of the tumor cell as possible to have focused destruction and spare other surrounding tissues. So you're looking at a nanometer size range of therapeutics. And Pluvicto is the first licensed theranostic agent in Canada for prostate cancer management. Next slide, please. This is my final slide and just encapsulates the last few minutes: emerging challenges and collaborative solutions. The regulatory rigor of provision of radiopharmaceuticals cannot be discounted. And this is where you need expertise. You need solid people running your operations to ensure that you are complying with the CNIC, Health Canada, FDA mandates. There has to be collaboration between developers of the ligands, between the radiopharmacies integral in that final mile of the shipment of the radiopharmaceutical, and the processing of that dose in a unit dose format. Specialized facilities there, it requires immense investments into GMP facilities for radiopharmaceutical production. And this is one of the major challenges to new radiopharmacies entering the market. And then in terms of logistical coordination, I spoke about that military style precision that's required across the supply chain. And this is where radiopharmacies are integral to ensure that right dose is delivered to the right patient at the right time. And that's the end of my slideshow. Thank you, everybody, for your attention. I'm available to answer any questions.
Excellent. Thanks, Sean. Sean and I met, I think maybe 4 years ago at a SNMMI conference, and had to, wrestle to get into the CNIC. But It's one of those things where everyone now is really noticing the impact that isotopes are having. I know there was a shout out for Novartis in that one, and I'll let Alex, when he comes up, speak about the great things that they're doing. But this really is truly innovation and innovation in medicine. And I know the word innovation gets thrown around all the time, but this is transforming lives and saving patients. So without further ado, I'm going to move on to our next speaker, Jack Zhu, who is the founder and managing director of HScan International. They are a leading specialty company in Canada, renowned for their premium tungsten parts and products tailored for nuclear energy, nuclear medicine, radioisotope, and diagnostic imaging sectors. Over to you, Jack. Thank you.
Thanks, Andrew, for the introduction. Good morning, everyone. Thank you for taking time with us today. So today I'm going to present you a magical metal material. It's called tungsten, and how its application in the nuclear sector. So here are the four main points of content I will share with you. What is a tungsten and the tungsten alloy and the tungsten properties of tungsten? And the third is how tungsten can help in the nuclear isotope industry. And finally, we can compare tungsten and its main competitor, lead, the metal lead, pros and cons. So first is tungsten is a metal originally found in 1781. And the name is derived from a Swedish term meaning heavy stone. It has been assigned the chemical symbol W after its German name Wolfram, and the atomic number is 74. It has grayish white and a lustrous look. It is a rare metal on Earth, and as we know, and China currently has the most global reserve and produces 85% of global tungsten output. Tungsten have two major types of finished product in the market, which are tungsten carbide and the tungsten alloy. So which we're talking about today is a tungsten alloy. Tungsten alloy has two common composition, which is a tungsten nickel and iron, and then tungsten nickel and a copper composition. The latter one is with a non-magnetic. So tungsten parts usually use a pressing metal injection molding, which we call MIM, and 3D printing for forming process. Thanks to the tungsten's excellent machinability, we can use various CNC machining process to produce a complex structured parts on pressed tungsten blank. In addition, tungsten has incredible high absorption capacity for radiation due to its high density. So this is a slide shows the property of a tungsten. First is a physical property. They have the highest melting point at a 3,422 Celsius degree. Pure tungsten has a density of 19.35 grams cc. Compared to tungsten alloy, take a class 4, for example, they have about 18.5 grams cc, only second to gold. And it also has an extreme hardness, second to diamond. It has an average about 35,000 to 38,000 megapascal modulars, which shows it's a strong resistance to being deformed elastically. In the chemical side, tungsten is a long-reactive metal and very much anti-corrosion. So tungsten, how we can help in the nuclear isotope industry. Let's look at the industry itself. So based on a statistic from a World Nuclear Association, over 50 million nuclear medical procedures worldwide are performed each year. Among them, 40 million using isotopes, with 30 million for diagnostic and 4 million for radiation therapy. In addition, sterilization of medical equipment is also an important use of isotopes. The demand for isotope and three major applications is steadily growing. Canada has been a consistent leader in producing radioisotope for medical use in the global stage. One of the examples is the cobalt-60, the most common isotope used in radiation therapy. Canada produces 70% of global supply and refines 90% of global market demand currently. Thus, we can see the Canadian market provides enormous opportunities for tungsten. The absorption behavior of tungsten alloy for high-energy electromagnetic radiation is derived from the high linear absorption coefficient of a principal tungsten phase. These alloys are excellent material for the shielding and collimation of X and gamma radiations. Due to their combination of its radiographic density, machinability, and its strength and low toxicity, tungsten it can offer a superior protection level to lead in an equivalent thickness. Like Steve company's Miron, they have a well-known product called ProTech path switching shielding. With only 0.34-inch thick tungsten, it can attenuate FDG F18 by 88%. The picture on this slide, the white container you can see is a FDG container, valve container. It's about 5-inch high and a 3.6-inch external diameter, and it weighs 31 pounds. So its tungsten is very heavy. It is a great tool for store and transport radioisotope. So we can say tungsten is also a great material for radioactive and PET waste bin containers. In the box shielding application, tungsten products have been manufacturing many shielding components in the 100 to 1,000 kilo size range. Large isotope container can be fabricated with a complex geometry radio beam ports using radiation joint construction. In that case, ASTM B777, like a class 2, 3, 4, are typically used in this shielding. And to take another example, so tungsten can be used for target interference skit, and also in that isotope production system, you can use it for decay zone and the Q zone shielding area. So lastly, let's look at two metals comparison. So tungsten versus lead. First and foremost is their density. Tungsten is 70% denser than lead, average at 18 grams cc versus lead is at 11 grams cc. When we use both materials with the same thickness in the shielding scenario, so tungsten has much better efficiency. Thirdly, we can see that tungsten generally has a smaller profile versus lead usually is larger and needs stainless steel to wrap. Next, we can move to see that tungsten is non-toxic versus lead is toxic. And in terms of its hardness, tungsten lead is about 1.5 in most value versus tungsten is a 7.5. It's 5 times like a hard. Normally, tungsten alloy have a HRC value at 28 to 32 HRC. And tungsten can be tapped, can be drilled, can be phased to have a complex structure, as we earlier discussed. On the other side, lead has a softer nature, and the pressure from the fixture and the cutting tools on lead-based parts can cause the product to be out of specs. And lastly, tungsten can resist extreme high temperature, but lead cannot. The only disadvantage for tungsten is very costly. It's about 20 times of lead for raw materials. So this is my last slide. So this concludes our slide. We are here. Aegiscan is a 20 years experience in the specialty material industry. We can here help your tungsten, the radiation shielding needs. Thank you.
Excellent. Thanks so much. Our last, but certainly not least presenter is Alex Wellstead. He is the Director of Public Affairs and Government Relations for Ontario at Novartis Canada. Alex has previously worked alongside Canada's Prime Minister, as well as a number of other federal and provincial ministers. Alex possesses a deep understanding of government processes and policy landscape. In his current role, Alex bridges the gap between government and the pharmaceutical industry, which, as we've learned from some of the challenges that were raised today, is a very important. So, Alex, over to you.
Thanks, Andrew. I'll just get my slides up here. Just 1 second there. Yeah, so thanks, Andrew, for the introduction. I'd like to first just emphasize how important it is for us at Novartis to have the opportunity to collaborate through the CNIC. Together, we have an opportunity to fully realize the benefits of nuclear isotopes, and the work the council is doing is key to that. So thanks to Andrew and to the whole team at the CNIC. So now, as Andrew said, my name is Alex Wellstead. I'm here on behalf of Novartis Canada. Like my fellow presenters this morning, I'll take some time to give you a sense of what we do, particularly when it comes to nuclear isotopes. So a bit for those who might not be familiar, Novartis is a global pharmaceutical company. We're headquartered in Switzerland. We're focused on bringing innovative medicines to people around the world. Here in Canada, we employ over 600 people. We have 2 offices, one in Montreal and one in Toronto. But a number I think that matters most, or more at the very least, is that in 2023, we treated about 1.2 million patients with our medicines, with about 50,000 of those receiving treatment through our support programs for patients. Again, that's just in Canada. As well, we're committed to innovation, something that is evident through our roughly $30 million of annual investment into research and development. Now, that funding, among other R&D initiatives, helps to support over 150 ongoing clinical trials, several of which involve nuclear isotopes. As well, we actually just recently made a major investment in Canada last month with roughly $150 million to help create Borealis Bioscience out in Vancouver. Now, our work spans a diverse portfolio of medicines with dozens of products, but looking very forward and looking into our pipeline, we focus on 4 key therapeutic areas: cardiovascular, renal, and metabolic diseases, immunology, neuroscience, and oncology. Now, oncology is a significant focus for us, as it includes our work in treating cancers with radioligand therapies, or RLT. So at Novartis, we see radioligand therapy as the future of cancer care. In fact, many clinicians consider it the 4th pillar of cancer treatment. Now, I'm certainly not a medical expert in this space, but the process is quite straightforward. The RLT connects the radioisotope to the ligand, which then seek and destroy the cancer cells with incredible precision. I think Sean called it military precision a bit earlier, but realistically, this is a game changer in how we treat cancer. Oh, sorry. Now, this is a photo you did just see. It's a bit bigger, but it's worth seeing again, because the impact that RLT can have, the impact that nuclear isotopes can have on patients with cancer, it's truly remarkable. I mean, as you can see, the photo on the left is a patient with metastatic prostate cancer. Their body is riddled with the disease. But on the right, after just 2 cycles of RLT, of Pluvicto, it's nearly gone. So that's what I mean when I say game changer. However, the precision required for RLT extends beyond just targeting cancer cells. The manufacturing and distribution process is incredibly complex. The isotopes we use have short half-lives, meaning that every second counts, not just for those isotopes, but for the patients whose lives depend on these treatments. So that's why we aim to be agile and efficient, and that includes working in close partnerships with folks across the ecosystem. Now, like I said before, we're a Swiss company. While we're not making Swiss watches, we equally want to have everything smooth and precise, or else that isotope, that dose, that hope is gone. But as many of you do know, the future of RLT is bright. We, among other pharmaceutical companies, are currently exploring its potential in treating a variety of cancers, including breast, lung, thyroid, and brain cancers. Currently at Novartis, we are leading the way in this space. We've got 2 that have received Health Canada approval. That's Lutathera and Pluvicto. But we are leading in the way that we want to see, making sure that RLT is a new standard of care in cancer therapy. But this is a team effort. We need Canada's continued leadership in the production of life-saving isotopes to make these advancements possible. So, in closing, I want to leave you with this thought. Our ability to maintain Canada's leadership hinges on our collective efforts. By working together, we can ensure that this ecosystem thrives. We can deliver the innovative medicines that patients so desperately need. We can change cancer forever. So I'm kept it pretty short here, but I look forward to hearing from many of you and finding out how we can all work together to help Canadians and people around the world live better and longer lives. With that, thank you.
Thank you very much, Alex. And I definitely could not have said it better myself. That's an excellent takeaway for this entire presentation, and hope that those of you online will reach out to the CNIC. I do apologize, but we are out of time for the Q&A. Any questions that were raised in the chat, we will share with the presenters and get back to you with answers. If you have any additional questions that you wanted to add or would have asked during this session, please reach out to myself or Melody. Our emails are provided on the website, CanadianIsotopes.com, and we will make sure that the appropriate presenter is able to answer. I do want to make note of a couple upcoming events for the CNIC. Our first is actually in partnership with the Canadian Medical Isotope Ecosystem. If you haven't heard of them, they are a tremendous partner of the CNIC and are really playing a pivotal role right now in ensuring that early stage companies have access to funding to get the next radio isotope discovered, scaled up, and ready for deployment. And I encourage you to again check out their website as well. This event will be on September 17th, Investing in Isotopes. Why now is the right time. And as the presenters showed today, there's tremendous opportunity, but these things require capital. And the CMIE and the CNIC in partnership together, putting on this event, hope to unlock some of those opportunities for our members. So please add that one to your calendars. It's on our website to register. And I will also flag our next event after that. I know I gave you guys a little bit of a layoff in the summer, so here's the tirade of events now. But on Tuesday, October 8th, we're going to be focusing on building Canada's isotope workforce in conjunction with Talent. That's an organization out of Ontario Tech. They're very focused on making sure that the nuclear supply chain and medical isotope supply chain have the correct skill sets and skills competencies for the next generation of workers. And we really encourage you to take part in this, because one of the key pillars for the CNIC this year is actually going to be education and building those skills competencies. So we really want to make sure that we have all the correct data as we kind of undertake this multi-phase approach. As some of you may know, we released a report with Talent last at our Leaders Summit, and this will be the next phase of that project. So add that one to your calendars as well. Of course, reach out, get on our newsletter. There's lots of things going on. Follow all the socials of all the organizations within the CNIC. There's truly remarkable investments being made, life-saving radioisotopes every day, changing patient outcomes. And I really appreciate everyone's time this morning. And with that, I will conclude the event. But thank you to all our speakers as well, our new members, and look forward to working with you in the months ahead. So have a great day, everyone.